Please, let's pray.
Okay.
We are praying. We thank you, Heavenly Father, for this wonderful day and how far you have brought us. We thank you for even guiding us from the beginning of the modules up to module 9. We pray and ask that whatever we have learned and whatever we are coming to learn today, we will put them into fruitful practice positively in our day-to-day activities. Whatever we are coming to share here this afternoon, we ask that God, they will be impactful onto our lives and onto the generations that we serve. We thank you for all the many blessings that you have showered on us now and forevermore. Amen.
Thank you so much, Kofi, for
Amen.
prayer.
Yes.
Okay. Right. So once again, welcome to our site meeting. This is chapter 5 of our site meeting, and today we'll be delving into modules 7 and then 8. 7 that talks about the systems thinking, and then module 8, which talks about projects and programs management. Okay, so we will start with module 7, which is the systems thinking, and then we're going to have a reverend to take us through, Reverend, good evening.
Good evening.
Yes. Yeah. Kindly give us an overview of what your understanding of systems thinking is. Then we will start the discussion. Yes.
Yeah, thank you so much. When we talk of systems thinking, we are talking of a holistic thinking. You put all the parts together and then take it as one. For instance, if I should use our the human system, it's comprised of a number of organs and a system of organs. Now you take one system and you realize it's comprised of a number of organs. So when one organ is affected in the system, the other parts are also affected. Take the digestive system for instance. You have a number of organs that make up the digestive system. Right from the mouth through the esophagus, the stomach, the intestines, with its accessories like the pancreas, the liver, all those ones. So when the pancreas, for instance, is affected, you realize that the body is not able to utilize energy. And for that matter, the whole system is affected. So when we are talking of system thinking, we are looking at various parts of should I say whatever we are looking at, the various parts of the project or the various parts of the program coming together and using all as one entity, so that you realize if one part is affected, the other part is also affected. So you are working on it holistically. This is how my understanding of system thinking is.
Great. Thank you so much, Reverend, for that insight. So we're talking about holistic, thinking. Yeah. And I'd like to find out from you once again, how do we, leverage the practice of systems thinking to the 7 habits which we we've been studying all along. How do we interrelate the concept or practice of system thinking to the 7 habits?
Yeah.
Yes, Reverend.
You know, it is difficult to address one part and then leave the other.
Okay.
As I said, so in system thinking, you want to understand the big picture, and then you consider the various issues that make up the big picture. And with this, you try to identify the various parts or the possible leverage points.
Okay.
Yeah. So you realize that in all this, you might have some challenges or some. So as you think of one part, you think of the other parts as well. So you consider all the consequences that are likely to rise up in the course of addressing the various issues. Let me use building as putting the blocks together to make up a wall.
Okay.
For instance, you realize you put in a particular block which is longer than the hole that you want to fill, and if you want to cut it, you are likely to cut it to be shorter than what you need. And this is the consideration of the various consequences that are likely to arise out of addressing the parts of the project. So, in effect, you need to consider all the various parts, looking at the various consequences, even as you consider the issues at stake, one after the other. But then you look at how best you will put them together so that as you solve one part of the problem, you wouldn't create a problem for another part.
Great. Thank you so much, Reverend, for these insights. Okay, let me find out from Kingsford. Yeah, Kingsford, good evening.
Good evening, sir. Hussein.
Yeah, please, how are you doing?
I'm doing great, sir.
Yes, let me find out from your perspective, how do you leverage the practice of systems thinking to incorporate the 7 habits? Yeah.
Oh, all right. Yeah. So good evening to all colleagues on board.
Yeah.
So, with respect to how to leverage the 7 habits in relation to system thinking, yeah, let me take you from where Reverend ended.
Yeah.
He ended by saying that in trying to solve any organizational problem, you solve in such a way that by the time that you are done, you wouldn't solve one aspect of the problem and then end up creating another problem at a different angle. Yeah. So with system thinking, just how it has already been said, we are looking at holistic thinking. So solving issue challenges holistically without having to bring undue negative consequences at other parts of the organization. So for instance, if we look at here, we have, let's say, habits to be synergy, for instance. So with synergy, for instance, we know that we're trying to put all our strength together so that together we come out stronger. And again, with system thinking, we're also looking at how every aspect of the organization can win so that together holistically we all win. So by means of applying this 7 habit, you end up achieving system thinking. And then if you're also going by system thinking, you have to employ some of these practices in order to be able to achieve system thinking. So if you are doing system thinking, definitely we want to put first thing first. We want to ensure that what are the very things that are so crucial for us to tackle to ensure that the whole organization improves or become better. And again, as an organization, we might always want to learn from our mistake. When problems come, you always want to learn the lesson from there. So increasingly, we want to sharpen our saw so that we become a better organization moving forward. So I think that by way of putting into practice these 7 habits, you end up achieving system thinking. And then you also want to go about system thinking. Definitely, you need to put in place some of these measures or some of these skills into practice so that you end up achieve system thinking. That would be what I would say for now. Thank you.
Thank you so much, Kingsford. Yeah. Okay. Let me find out from Mr. Festus. Yeah. I'd like you to share your perspective on the practice of system thinking and then also the
Thank you very much.
Yeah.
Okay, thank you very much, Mr. Hussein. I think Reverend and Brother Kingsford have spoken at length about systems thinking. And as said by Brother Kingsford, when you talk about systems thinking, and Reverend, it's about the holistic nature in which decisions are made, how we think about problems in organization, how we think about approaching issues within our institutions or our departments. When we talk about systems thinking, as said earlier, it's about thinking not only from our levels perspective, but putting ourselves in a different level. So let's say we think from the situation at hand, how will those at the bottom of the organization see it? How will they react to it? How will those in the middle, how those at the top? How do we think from, let's say, the perspective of finance, we think from the perspective of, let's say, the nurses, the totality, every aspect of the organization. When we are making decisions and we bring issues from these various aspects of our organizations into board, the spirit of synergy is brought on board because the contribution from the various professional groupings, the various skill sets of the institution is brought on board. And, as it's brought, the combined efforts is bigger than the individual efforts put together. If we are planning or approaching an issue and we look at it from the various perspectives, we are being proactive in effect, we are being proactive as is found in our 7 habits, So in a system thinking, I don't want to take it one after that. As Kingsford approaches, we are undertaking projects. And we look at it from we see how we can bring the various professional groupings on board, how we can look at it from the low employee level, the middle, and we'll see the combined efforts bring about synergy, bring about win-win, and all the 7 habits will come on board and we achieve greater results compared to if we leave some aspects off. Thank you.
Thank you so much, Festus, for these ideas. Would building up on the systems. Okay, that's great. I would want us to look at move to our next slide. Okay, and as part of the model, where part of the activity we're supposed to do was to view the everyday leadership video that deals with this particular topic that we are talking about. So we're saying that from that video and from our own experiences, how do some leaders practice systems thinking even when they don't call it by that by that name. How do leaders practice this particular concept without necessarily even not being so conscious about it, or calling it even by that name? Okay, so let me move to Reverend again, just an opener on this discussion, then we would move on. Reverend, yes.
Yeah, thank you so much. Many times, people practice certain things, certain philosophies, and I mean things like that they are not conscious of what they are doing. So people will normally want to work in such a way that they involve the various aspects of the project.
Okay.
Like with coordinating the various aspects of the project. Meanwhile, they are not conscious of any formal philosophy that they are practicing, any formal theory that they are practicing, any formal model that they are practicing. So it is in our everyday life and our day-to-day activities that some leaders actually practice systems thinking when they are not actually conscious of the formal discussions on it. So this is what I would like to open it with.
Thank you so much. Okay. Let me move to Sharafin. Sharafin, good evening. Hello, Sharafin. Sharafin. Yes.
Please, can you
I'd like to find out from you.
Where I am right now, I'm actually a bit busy, and okay, I've really not been paying so much attention.
Okay.
The next slide.
Hello. Hello, Sharafin. Yeah, we can't hear you clearly.
I was saying that I have baby issues right now.
Okay.
If you can
All
let
right.
it slide, maybe
Yeah.
the next slide.
Yes. Okay. That's understandable. Okay. All right. Okay. Yes. Okay, so we'll continue. Let me find out from Mr. Simon. Yes. Have you come into a situation where you have applied system thinking and sort of like subconsciously, like you executed a particular program and then imbibing the concept of system thinking when like you didn't sort of like know that that's exactly what you were doing? Have you kindly share your experience with us if you have? Yeah, Mr. Simon. Hello, Mr. Simon. Okay. All right. Okay. Yeah. Okay. So let me. I think I see Sandra, your hand is up. Please go ahead. Yes.
Okay. So please, can you hear me?
Yes, please.
Okay. So in my department, I just want to give an example of what we used to do. I didn't think it was system thinking until I had this course. So every year, the central administration asks the department to generate its own program of work. And as part of that, what normally management we used to do is to get all the various subunits. So then we ask for input from finance, we ask for input from HR, we ask for input from the carpentry, the maintenance section. So every unit thankfully too, we were having, every unit had a member that was part of the department. So for instance, the one in charge of maintenance, if your things get spoiled. So we make sure everyone brings in their inputs before we draw the final thing and submit it back to central administration. I didn't really see it as a systems thinking something, but with the benefit of what we've learned and looking back and reflecting, I've realized that even though we didn't realize that's what we were doing, we're actually looking at the bigger picture and making sure that all the units were making contributions. And since it's coming from the various units, they know the peculiar challenges they face. So they're able to pick out peculiar things that together we find solution to, just to make sure that whatever we come out with is holistic enough to solve the issue that is on board or to achieve the goal that we set for the department. Thank you.
Thank you so much. Fantastic input and then insight on how system thinking is being leveraged. Yes. Let me find out from you, Sheriff. Hello, good evening, Sheriff. Hello, good evening, Sheriff. Okay, thank you. We seem to have a little bit of challenge there. Okay. Let me go to Comfort. Yeah, Comfort, good evening. Yeah, good evening, Comfort. Okay. I think we're having a little challenge with the participant connectivity. All right. Okay. All right, Godfrey. Hello, Godfrey. Okay. We seem not to be connecting so much with the participant. Okay. So yeah, essentially it's the idea about systems thinking. If you break it down, it has to do with teamwork and then getting all the various elements that make up or contribute to the holistic solution to the problem there. So that's exactly what the systems thinking is about. But I'd like us to go to the our next slide and then find out how well do the concepts and practices of systems thinking apply to our cultural setting. And we're going to use the situation of this coronavirus and to look at it from the point of systems thinking, like in trying to solve this pandemic, particularly in our country. Have we, as a country, applied the concept of systems thinking to make sure that all the key stakeholders have come on board to help us to effectively deal with this particular pandemic? What do you think? Yes. So the virus pandemic as our case study, and then we're going to look at it if we've been able to apply the system thinking and how or how not is been able to help us in dealing with this particular pandemic. Yeah, let me start from yes. Kingsford. Hello, Kingsford.
Mr. Hussein, I'm here.
Yes. Okay. I'd like to have your thought on the application in our own setting here in Ghana. So we are looking at the pandemic, and then we're asking ourselves, have we employed, looking at the advantages of systems thinking in trying to solve this coronavirus pandemic, have we as a hospital, as a country, applied the concept in addressing the coronavirus pandemic here in Ghana? What do you think?
Hello, can I be heard?
Yes, please.
Yeah, so to begin with, so in a way, I would say yes, in a way, we've sort of applied it in a way or to some extent, in the sense that looking at coronavirus, as it unfortunately came in on this earth, you realize that this virus started from China, and then if you look at the fact that I just want to beginning from it there, and then I'll zero down to we as a country, Ghana specifically. If you look at the fact that as coronavirus, for instance, it started in China initially. People thought that, oh, it's China who have had, their own disease. And they realized that initially other countries didn't much bother until later realized that it was spreading fast to other nations. Then we all began to be cautious of it. And for that matter, as a country, Ghana, when it first hit our lands, we realized that yes, there was the tendency that this thing is going to affect our life generally as a country. And for that matter, we began thinking aloud. So government came in with what they think they can do. Government came in with policies and measures to put in place so that it begins to protect all of us, so that it doesn't overpower us, or we will not be overwhelmed with it. So government came with policies of do this, let's do that, let's do that. Needed the support of what? Of health professionals. Government needed the support of researchers, scientists, at the point that we needed the input of what? Those in the academic field, so that they all bring their ideas on board to ensure that together we solve this issue holistically. Every time when as the president spoke, he has always highlighted the fact that all of us must come on board. We shouldn't lose our guard down. We shouldn't lose our guard, because rather than when a part of it is affected, then you don't look at other part of it and then begin to solve it holistically. You end up, or it will end up affecting all of us. So as a nation, I think we have in a way employed, because health professionals had their part to play. The government had their part to play, which they were doing. And then we as citizens too, we had our part to play. And realize that by so doing, each one of us playing our parts of the game together, realize that in a way, it has helped us to be able to contain the virus to a greater extent. So to begin with, I think we are in a way applying the system thinking, because we are looking at the fact that every part of the system, churches even had their part to play, okay? And then by so doing together, you've sort of been able to contain it. So I think system thinking has been employed to some extent. Thank you.
Thank you so much, Kingsford, for your submission. From Kingsley, yes, Kingsley, please go ahead. Yeah.
Hello. Good evening, everybody.
Yeah. Good evening.
Looking at when we talk about system thinking, generally it's an ecosystem where everybody plays its parts, or all the parts in a moving organism or a moving body unite. It works together to achieve a single goal. And if you look at how COVID-19 was handled in this country, I would say it wasn't match to a full extent of how we defined system thinking, because the protocols that were put on the ground, it wasn't covering all Ghanaians. For example, the people that we had people that are working in the field. We know that those people are attending to COVID people, and those people are aware that they are attending to positive cases, and they were given all the right equipment, the PPEs and everything that they needed. But there were nurses or medical staff that are working, and they were not working with COVID-19 people, but yes, though they were exposed, but there wasn't any adequate protection for them. So if you look at how we define system thinking, as we look at the whole picture, as we say holistically, it means that we didn't do our work right. We didn't look at the bigger picture, because we were looking at the people who be attending to the COVID patients, but the COVID, it wasn't visible. If someone had COVID, sometimes the symptoms might not be visible for you to see, say, this person is having COVID, so let me be careful. So if you are a nurse, or you are attending to a patient and you are not well covered, you are not protected, you don't have the right logistics to attend to a patient, you realize that that is the main cause of casualties or morbidity among the medical staff. You realize that those people who had the COVID, the nurses and the doctors who had the COVID, didn't know that they were attending to COVID people, because they were not, how should I put it? They were not working, they are like where they are working, it wasn't classified as attending to COVID patients. It was classified as working on like general, say OPD, general treatment. So there was no protection. And if we are looking at how we can incorporate system thinking with regards to COVID, I realize that it's not what I realized, it is what it is. The government didn't do much in that aspect, but just like Mr. Kingsford said, the protocols that were put in place were followed, but recently you realize that the protocols too has come down. So the implementation of it is mostly as a result of, in our country, when you speak about some of these things, you'll be labeled as belonging to a particular party, but the problem is still there. We know that currently the number of cases are going up, and they are not saying anything about it because they want people to come out and vote. But the problem is still there. So if we are looking at system thinking, it means that every protocol that we put in place must affect everybody, and every logistics that goes out. There are other facilities that, health facilities, that if you ask them what logistics or what supplies have you been given by probably the regional medical stores, they will tell you, "Yeah, but the government has allocated a huge sum of money to fight COVID. But there are people on the grassroots that haven't received anything." So it means that the system thinking is working to a certain level, but as we are talking about a holistic approach with regards to COVID, it is not covering everybody. I think that is my take on it.
Okay. All right. Okay. Thank you so much. Yeah. Yes. Let me have a Sheriff. Let me have your take on this particular thing. Recently, we are hearing from the news that compliance rates to the protocol, particularly the face masks, people are not wearing the face masks in the communities, or in the, like, what do you think is, as part of the chain, what part of the chain is not working or not working, which is contributing to people not sort of like complying to some of these protocols? Yes. Yeah, Sheriff, please go ahead. Yes, kindly unmute yourself. Yeah. Hello, Sheriff. Yeah, I think we're having a little challenge with Sheriff connectivity. Okay. Yes. Yeah, let me find out from Kofi.
Hello, yes, sir.
Yes. Yeah.
Okay, good afternoon, everyone.
Yes. What do you think is accounting for people not complying so much with the protocol? What do you think, as part of the system, is contributing to people not complying to the protocol?
Okay, thank you, sir. I think with this COVID-19 pandemic and whatever measures that were put in place, system thinking went into it because I heard from various communications from the president that most of the decisions that we were arrived at were based on the data at hand. So then I asked myself, where from this data? Data means they took the data from various sectors that were affecting our country. When you look at education, health, transport, and so on and so forth. But along the line, I noticed that the breakdown of people not complying with the use of the face masks was that there was a breakdown in education and then in communication, because there was not much education and communication. So, for instance, when you go to some communities and you are with your face mask, they start calling you names and then they look at you in a different way. And some of them even come and question why you are putting on the face mask in their whilst you are in their community, because they don't believe the COVID is even in Ghana. Then I ask why. Then they tell you, if there is COVID in the system, what will be my proof, or how can I prove to them that it is in the system? Then I am taken aback, because I thought they have also seen or read on most of the media this news broadcast and whatever. But I sit back and ask myself, that is government doing much about educating the populace? Then I'll say no. Some also has to do with our personalities. The protocols that were put in place, most of them we don't abide by them, because we think they were so burdensome to us. For instance, I understood it that if, for instance, you are in the hospital facility and you walk out, you have to wash your hands back before you enter. But how many of us were complying to the washing of the hands? How many of us were complying to the use of the hand sanitizers? How many of us complied even to wearing of the nose masks at various times? Because uh, people told me in confidence, Charlie, this thing, when I wear it, I can't breathe properly. When I have complications, and it's true. When you wear it for long, myself, when I wear it for long, I don't feel comfortable. What even worsens the case was that, you see, when you put some of them on and you are even talking on phone or whatever, you don't hear. So you have to either bring it down or remove it or whatever. So all these things were contributing to the fact that even when I see a lot of people around me not wearing it, and they are not being infested by the disease. So, and there was another instance where I was in a community and people were attacking me. You can't enter here with the nose mask. Why? Do you think we are this? Do you think we are that? This was one of the how do you call it, the fishing communities. They believe that the moment you feel unwell and then you just go to the sea and then you bath one or twice, you are healed. So they don't see why they should be wearing the nose masks or be bothering themselves, washing their hands and using the hand sanitizers and so on and so forth. So, like I'm saying, I want to conclude by saying education. The education broke down. The education channel broke down completely with all the measures that were put in place. Thank you, sir.
Okay. So from your perspective, the reason why we're having compliance challenge in the system is the education. Like if we are able to fix the education or communication people, we should be able to resolve the compliance. Okay.
Yeah.
Reverend, your hand.
Yes.
Yes.
Okay.
Yes.
Then I'll come to
one thing we need to understand is that system thinking looks at the problem holistically. I just want to use the frontliners in the fight against the COVID in our various institutions. As an example, the government did well by relieving the health workers, the tax, and the other things. But one thing I realized is it at a point in time, it became demotivation to some people too. Now, just as Kingsley said, those who were actually working with the identified cases were given the full regalia with regards to the PPEs, and the others were exposed, even though the people that were coming to them did not show any sign, but then some of them might have the virus. And if we will be honest, those who were infected more were not those that were called the frontliners, were not those that were directly working with the cases. Now, my point is on the 50%, the 50% of their basic allowance that were given to the front liners. Somebody who cleans the place for the front liner to work thinks he or she also deserves something. Now, somebody who gives medication thinks he or she deserves something. And critically looking at it, you realize truly everybody needed to be given some something, or to be identified as somebody who is taking part in the care of the victims. But then here is the case where some people were sidelined, and looking at the key roles that they play became demotivated, and for that matter, they thought, if I am not recognized for my work, then why should I bother myself? And that is part of the reason why the frontliners were overwhelmed, because they didn't receive any support, because those that were to support them have not been taught as people that also play some role in the care of the patients. So that is what I want to add. We need to go to the minutest part of the system and then look at how best, at least, we will use it to the advantage of the system. Thank you.
Thank you so much, Reverend, for that insight. So we're looking at, in our culture setting, COVID-19 and then systems thinking. How have we applied it in order to solve the problem? Yeah, let me come back to Sandra on the compliance. What do you think is mixing in the system, which is accounting for high incidence? Recently, we are hearing that the infection rate is increasing, what do you think is, as part of the system, is contributing to the increase in the infection rate? Yes.
Okay, so thank you. I think a lot have been said about my previous colleagues who spoke. I believe that systems thinking is actually supposed to be a continuous something. You see, initially, well, with all the challenges and the broader or more complex the system is, even though you might be involving all the stakeholders, sometimes you don't get it as you want it. What I realized was that in the government's efforts, they probably left out the local people, like the chiefs, the opinion leaders, because some of the things, like Kofi rightly said about the fishing areas, sometimes if you involve their opinion leaders and their various chiefs to understand, then it's easier to penetrate to those bits. So on the national level, it looked great. It looked great in terms of what they were saying. They actually, if you look at the plan that they put out, it was quite extensive, but getting it to the grassroots, that was the problem. And I think it was because as part of the education, they did not really involve the opinion leaders and the traditional people, so that everywhere somebody is, they get to understand. And sometimes to the convenience of it. You know, it's easy to say people should sleep or should be like 1 meter apart. But here is a situation where people are living in very crowded areas, one room about 11 or 6, or I mean, how realistic do you think some of these things were? Sometimes I think the reason for these failures could be that some of the things were just said, oh, use nose masks, keep 1 meter apart. You just said it. In my reality, it's not convenient. Probably the government didn't look at ways to address these specific ones. And so then people just realize that what's the point? I mean, it's not possible for us to do, and I need to survival is first. And because the targets, the people who were most affected were the elderly and those that were vulnerable. Our country, we are about 70% or something percent youth. So a lot of these people have high immunity. So we're not really seeing it. And of course, they were talking about climate and all. So it was people, one, it was not convenient, and two, they are living in a system where majority of the population are likely to survive it, even if they get it. So then, I mean, why should I put on nose mask? Like Kofi said, if it's so uncomfortable, if it's so there. So I think these were some of the gaps that are resulting in the non-compliance. Thank you.
So stakeholder engagement as part of the system could be attributed to these incidents of like rising cases. Great, thank you so much. Yeah, let me hear from Cynthia on what do you think as part of we've seen situations where those are the we had a Reverend mentioned about it, the frontliners, the number of misinterpretation of who is the frontliner. What do you think as part of the system contributed to this misinterpretation of who is a frontliner and who is not? What do you think as part of the system? Yes. Yes, Cynthia, please go ahead. Hello, Cynthia. Hello, Cynthia. Okay. Yeah, I think we are having a little challenge with the connectivity. Okay, but let me find out from yes. Simon. Hello, Simon. Good evening, Mr. Simon. I think we're having a little challenge there. Yes, Mr. Simon. We don't seem to get Mr. Simon. Let me come back to Godfrey. Yeah, hello, Godfrey. Hello, Godfrey. All right, Sheriff, your hand is up. Yes, please go ahead.
Hello, can you hear me?
Yes, please.
Sorry, I was having a little bit of a challenge when you were trying to get to me.
Okay.
Yes. Much have been said regarding why the general population is not really complying with the safety protocol. I don't think I totally differ with those who have said it, but in my opinion, a major reason why a lot of the people might have relaxed with regards to using the face masks as actively as is expected, washing hands and ensuring social distancing, has been the fact that the fear that we had, the initial fear that was attached to the disease, has essentially dissipated. It's more like gone away. We are no more afraid of the disease as we used to. How we thought the disease was going to ravage us is not what we are seeing. A lot of the people haven't really seen or come into contact with people who have really been said to have had a disease. So it's more like we are not seeing them. And indeed, most of the cases that are being reported are those who have had infections, all right, but they have just mild symptoms, or they are even asymptomatic. A lot are asymptomatic. Those who are showing symptoms have mild symptoms, and so a lot of the people are thinking, oh, it's just like any normal flu or cold. It's not really causing a lot of death as it's happening in the West. So as far as we are concerned, we are good to go. The other thing has to also do with the fact that there's an irony of, as one of the speakers said earlier, there's an irony. Yeah, you go to the market area, you have people overcrowded. We go to the market all the time. You see, we go to grocery shops, we walk in town and all that. And a lot of people are not practicing social distancing. And it doesn't seem to really affect us. So when all these things are going on and someone say that, okay, ensure strict social distancing protocols, it begs to the question as to whether really that is very important. And in addition to this is also the fact that now we are beginning to understand the disease a little bit better. And when initially we didn't know whether it was by contact or droplets, now it is largely airborne. And if it's largely airborne, and airborne precautions are supposed to be ensured, then you tend to ask yourself whether, okay, if it is airborne precaution, should you necessarily have to be washing your hands religiously, as if the disease is being spread by contact or by droplets? So all these things are more or less going on in the minds of the public, and by and large, it's more like we are living with a disease, and a lot of people are not really dying from it. So they don't see the reason why they should even ensure these safety protocols as is being more or less cautioned by the government. And generally, too, we know that when the lockdown was effected, a lot of people were not comfortable with it. So gradually, it was relaxed, and we have bounced back to normalcy. So in the midst of all this, really the fear of the disease has really gone down, and people don't really seem to care or whether the disease is going to like it's totally gone. Until we actually drum into the heads of the people that okay, it's the disease has come back. We are now having a second wave and people are dying from it. So let's go back. Nobody's really going to comply. That's how I'm seeing, and I think it's one
Okay.
of the major reasons why. Yes, and I personally, on my part, for a very long time I was not getting the update as we used to get from in the beginning of the pandemic. So it appeared to me as though, okay, no update. So we are not being reminded. And so we are not being cautious. But now that we are hearing that second wave numbers are rising, we have gone back to at least put on our mask and things like that. So I think as far as the system is concerned, that's where we have to regularly remind the public that okay, even though we are suffering from only mild disease, the disease hasn't totally gone yet, and then we have to put in a lot of effort to at least ensure that it doesn't spread even further, even if we are not coming down with severe disease. When we continue to say that, maybe there will be an improvement in the compliance with regards to some of these protocols. And then the other thing that you asked or has to do with the frontline workers. I didn't seem to get the exact question. You said something about frontline workers. I didn't understand that. So, but if
Yeah, the
what yeah.
the question I was asking is there was a lot of debate about who a frontliner or a frontline worker is. So my question is, what was part of the system that was missing that created this agitation? What was missing in the system that probably led to misdefinition
Oh,
of?
okay. Okay. Basically, I think you see, the way we are as a people, you see, when the word frontliner was used from the very beginning, every health worker would have thought that he or she is part of the frontliner. But unfortunately, when the frontliner was used, and almost immediately it looked like the authorities were trying to remunerate or motivate a certain group of frontliners, then the agitation came. It would have been very much okay if it hadn't been said that some frontline workers were going to get some 50% or were going to get some kind of allowances and blah 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 blah. So the benefit that was attached to the definition was what caused the agitation. So what the system could have done was, of course, to have clearly come out to define who a frontliner is. And they should have also taken time in ensuring that, okay, even if they're going to define these frontliners, you're going to effectively categorize them and say that, okay, for this particular group of frontliners, you are going to do 1, 2, 3, 4, 5. For that particular group, 1, 2, 3, 4. But they were too quick into saying that a certain group of health workers were frontliners, and that sort of enraged the other aspects of health workers who thought that okay, they would face the disease anyway when they are at work, and they were not part of the definition or the categorization, and allowances that were going to be given to them will not affect them. So it sort of muddied the waters at that time. But the authorities sort of realized it and then tried to put some kind of strategies in place to quieten the situation. So that was done. But the truth was that it fizzled out after a while, maybe a form of deception, because the truth was they said that okay, everybody was a frontliner. But indeed, there were still some categories who were going to be given those kind of 50% in allowances, and then it's made it a bit better. So that's what they should have done earlier on. They shouldn't have jumped into coming to make promises, and then that sort of enraged everybody. So that is what was missing in the system. So we should be patient and then find a very pragmatic way of delivering information and getting everybody to understand the situation so that in future will not be agitated and not more or less trying to frustrate the system and allow everything to go on. So that's what I think I will say regarding this one. Thank you.
Thank you so much for your input and insights. Yeah, Festus, your hand is up. Yeah, please make it.
Yeah, thank you. What I wanted to contribute to or add up to what Sherif just said about government issue with frontliners. To me, I think government consultation about the issue of who frontliners were in the health sector was inadequate. To me, government rushed into this issue of frontline and non-frontline issue. In the health sector, the activities are holistic. They are collaborative from different sections, and it was difficult categorizing people as frontliners and some as not frontliners. To me, if the financial remuneration would have been a challenge, for which reason government wanted to take some people out and include some as frontliners, government should have remained with the tax incentive uh, he gave to health workers and left it as there. And I think uh, the health workers were willing to contribute all to the fight of COVID. But when the mention of 50% was given, was made by government, it's unrealistic that government will pay all health sector workers 50% increase in their salary and also take away their and give them tax incentive. The wage, the financial burden would have been very huge for government. I think government had left the decision at where he gave the tax incentive to health workers. There wouldn't have been any agitation at the health sector about who frontliner is, and people now feeling that because I'm no longer a frontliner, then we leave some fight for those who are categorized as frontliners. Then about the issue about wearing of face mask. I think one area our nation we've not done well, and for which reason people may be relapsing in the wearing of face masks is because of the bylaw. There is a bylaw about the non-wearing of face mask and what will be done to people who don't wear the face mask. The charge associated with non-wearing of face mask is just unrealistic. The amount, the surcharge people will be, or the amount that people will be levied for not wearing face mask. In fact, when even a policeman arrests you, it's unrealistic that he will demand you to pay over 10,000 Ghana cedis for not wearing a face mask. The law was bad on that side. I think if the levy had been kept something moderate and the implementation possible, once it's done to one or two people, the implementation of the possible, people will be wearing face masks. But you can't catch somebody and levy the person about 10,000 Ghana cedis, the offense being that the person didn't wear a face mask. And in addition to that, I think our leaders on the political side have not set a good example for the lay people or other citizens to follow, in a sense that if we look at the way our politicians are going about their political activities, the political campaign, it puts the fear out of people, that the way the fear people had about the COVID when it was coming in somewhere March, April, May, the fear seems to have gone down, and therefore everybody is going about the normal business, and people don't think there's any issue about COVID anymore. In fact, you interact with people, you talk about COVID, and they tell you, oh, I think perhaps we may all have contacted it and have recovered by the way. So I like the fear within people when it comes to this COVID issue has really gone down. And that's a contributing factor to the neglect of all these measures to avoid COVID. Thank you.
Thank you so much. So, we've had quite a number of input into the various parts of the system, which is in one way or the other is contributing to helping. I believe that with all the ideas that have been shared, if we are to go back to the drawing board and fix these elements as part of the system, we will have a more, effective, approach in in tackling the pandemic. Thank you so much for all the wonderful insights and then contribution. Would want to move to the next discussion topic. It has to do with the program or project management. Yes, everything falls under, in one way or the other, either a project or a program. Yes, so our fight against COVID-19, for example, it's a whole project or a national program which you can divide it into different projects, and then see how best we can be able to execute it to our effective, to get the effective deliverables. So our first discussion question is, how useful is the constraint? The constraint, we learn about the constraint triangle in executing a project. So we're saying that how useful is the constraint triangle to you in terms of helping you to manage projects and communicate with others about, changes. So the constraint triangle is what we have on the slide, which is cost, scope, and then timing. Yes. In order to get a very good outcome of a program or a project, we need to balance these three, constraints to be able to get effective outcome in the project or program. Yes. So would like to have your take on this, on the constraint, triangle, and then how useful it is in applying it. Which ones are we balancing? For example, if you're trying to minimize cost in a project, it means that either the time of the project will be long, or the quality of the project will be compromised. If you try to minimize time, then maybe we'll have to increase the cost of the project and also modify the scope. That's if we want to minimize time, then the deliverables have to be broken down. If you are targeting, let's say, 70%, if you want to achieve it in a shorter time, that means that you have to compromise one element of the constraints. So how do we now balance each one of these in order to get a very good outcome in a project or a program? Yes. Okay. So as a discussion starter, yeah, Reverend, let me have your take on this one. Yes.
Okay. Let us use this COVID-19 as our case in question.
Yes.
The whole management of the pandemic is a program that has a number of projects, and one of the projects is the hand washing, the sanitization. Other project is the quarantining of suspected cases. I mean, it has various components. Other project is the actual management of the case. Other project is the educational aspect, where people are being taught now. Now you want to address this holistically, and you realize each of the projects cost. Now, some of the projects may take longer time, others may take a shorter time. But then you realize that if you want to manage time, maybe you want to shorten the time, then other part of the whole management will also be affected. So you need to look at the scope, what goes into each of the various projects. Now, these projects also come with cost. So trying to balance all at a point in time will give you a quality program or project. But then, if you want to sacrifice parts, maybe cost for time or time for cost, you realize at the end you are not addressing what you are supposed to address. So balancing all this is very, very important in projects and program management. Yeah, so maybe to open it up and
Thank you so much, Reverend.
let me end here for the time being. Yeah.
Yes. Thanks so much for your opening as a discussion, a starter. Yeah. In how to effectively balance the constraint triangle, and how do we use it in a way that will get effective outcomes in the programs or the projects. And I like the example which you give about the pandemic. Yes, it's a program. Yes, the government periodic communication is one of the projects. The hand washing is another project which we can even take as a national program, making sure every Ghanaian, every citizen is abiding by the protocol, and so on and so on. So many different projects and then programs. Yes, the provision of free water to communities, or the foods that were shared, is another part of the national program. So there's so many angles to it, and each one of these will be affected, just like Reverend rightly said, by cost, scope, and then also time. Yes. Let me find out from Cynthia. Yes. Cynthia, good evening. Good evening, Cynthia. We don't seem to get Cynthia. Okay. Comfort, good evening. Good evening, Comfort. Okay. I'm not getting Comfort. Okay. Let me find out from Kingsley. Yeah, good evening, Kingsley. Hello, Kingsley. Yes.
Can you hear me?
Yes, please. Yeah. Let me have your take on how to balance these three, key elements or constraints, and how do we leverage it in executing a project or a program. Yes.
Okay, so just like Reverend said, with this constraints triangle, it helps us to pay the quality outcome of the project that we are undertaking. You cannot forgo one, or you cannot reduce one and say, because maybe we want to save cost, we will reduce the amounts that we need. Just looking at the very example that he used with the COVID example, you realize that you cannot say because we are spending too much on probably with a hand washing, for example, maybe we are spending too much on liquid soap or paper towels. So let us stop with the hand washing. When they come, we'll just check their temperature, and if the temperature is okay, they can pass. Because we want to reduce cost. We realize that the person might be carrying the infection in his hands or her hands, and they enter the facility, and because you are trying to reduce cost, you might end up increasing the spread of the virus in your facility. So with this, to make sure you are getting the right quality of whatever you're undertaking or the project that you're undertaking, you make sure that you have all the rights, the cost, the scope, and the time. Everything is equal, or is in their right quantity that supposed to make the thing. Other than that, you end up wasting money and wasting time and resources without achieving the right goal. And there's a saying that the poor quality is always expensive. So if you realize that you are undertaking a project and you realize that you are not ready to spend the full amount to get the desired results, it's better you don't even start at all, because you are ending up wasting much money or wasting the money that you started without getting the desired results. Thank you.
Thank you so much for your input. Yes. Thank you so much. Yes. So we can't compromise one in you have to take a balance, just like we mentioned about the systems, a balanced approach in such a way that we'll be able to achieve the expected result. Yes.
Yeah.
Thank you so much. Yeah. Yeah. Let me find out from Kofi. Yeah. Let me have your intake, your take on the constraint triangle and how useful it is now knowing about it, how useful it is in approaching a project. Yes, Kofi.
Okay, thank you. Okay, thank you. Please, can you hear me?
Yes, please. Yeah.
Yes, the constraints. I noticed from experience that the most the scope and the budget effectively affects the time.
Okay.
When the budget changes, it affects the time. When the scope also changes, it affects the time. And in rare occasions, when there is time constraint, it doesn't affect either the budget or the 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 scope much, depending on the project at hand. But in other occasions, time also affects these two also in a different way. Um, I will say that the budgeting has has been one area that greatly have impact on projects. Looking at, for instance, in our public sector, how we go about our finances with the due diligence and then the procurement processes and so on and so forth. So you see that a project is to be run and then this budget constraints sets in. A typical example is with this COVID pandemic, whereby um, accessing PPEs and whatever becomes a problem because there's budget constraints or you have gotten to limit. So applying for or getting others to come in, you have to either arrange for your own financial arrangement, which also will take some other time. Like I was saying that you see that now it is going to affect time. You see, so these are my few observations on the constraints.
Thank you so much. Yeah. Thank you so much, Kofi. Yeah. Okay. All right. Yeah. So let me going forward. Let me find out from some. Yes. I'd like to have your take on how do you use it, or how might you use it in the future to guide your work, as in the constraint triangle. No, appreciating the constraint triangle in terms of scope, cost, and then time in executing a project or a program. How it, or how do you intend to use it in the future to guide the work that we're doing? Yes. I want to have your take on that one. Yes.
Hussein, is it me you called?
Yes, please.
Oh, okay. So yeah, so I think like it's been rightfully said. So what actually helps you to do is to be proactive.
Okay.
When you are planning, because sometimes you think you have the money, you may have everything, but things that are beyond your control can easily come in that would you need to go back to the drawing board to see how best you can make up for the constraints that come. So you need to forecast, knowing this, that these are challenges that might come up. So if you look at time, thinking ahead, what are the issues with time that can come up, looking at scope. So it helps you to forecast or try and foresee them and then make alternative solutions to address them, so that in case you come across them, then you're in a better position to see how best you can resolve and have your goals achieved. Thank you.
Thank you so much, Sarah, for that input. Yes. Let me find out from Kingsford. Yes, Kingsford. How are you using the constraint triangle? Hello, Kingsford. Hello, Kingsford.
So I was saying,
Yes. We want to find out how are you using the constraint triangle?
so I was saying,
Yes.
please,
Yes.
Please, I've started for the past 15 minutes. So kindly pass it on. I'll come in later. I beg you. I need to attend to something. Yeah.
Yes.
Thanks so much. Okay.
Okay.
All right. Okay.
Yeah, let's find out from Festus. Yes. How do you use the constraint triangle?
Yeah, thank you, Mr. Hussein. You know, the constraint triangle, all the three constraints we are talking about have effect on each other. A change in one affects the other two. You know, usually in talking about the constraint triangle, especially when, in respect of the budget or the cost, we are tempted to think of only the monetary aspect. But our budgets can come in the form of human resource or material resource. You know, a change in it can affect the scope of work we do and the time it will take us to complete. So in my work, I work as an accountant. Yeah. So in every decision, I will be more thinking from the financial perspective and the work we do. In budgeting for my institution, carrying out every activity, when I was an auditor, in my audit role, yeah, I was in my constraint in terms of budget. The budget aspect of the constraint was not necessarily in terms of financial funding, but it was in respect of the human resource I had to carry out my activities. That's the auditors I had to carry out the activity, and the scope of work that I was to achieve. That's part of the books I was to audit. So in carrying out our day-to-day activities back then, I looked at the human resource I had and the task ahead of me. You know, I had a limited time to carry out my duty, so I will plan what to do along with the human resource I had. You know, my time was limited, you know. So that's how it affects our day-to-day activities. My work as an accountant now, I'll look at, in a training institution, I'll look at the various aspects and what you have to do, my student population and all those things, to plan around it in terms of my finances, the scope of work, and expenditure to incur. So these activities, you cannot alter one without affecting the other. They affect each other and they are intertwined. Yeah. Thank you.
Thank you so much, Festus, for that input. Okay. So we're moving on. Yes. So on the program or project management, and in this program or project is a whole skill, and there are certain skills that we need to sort of like have in order to be effective in executing programs or projects. So many skills, involved, and would like to throw out to the house. What are some of the skills that we think or feel we need to develop if we want to be effective project managers? Yes. What are some of the key skills or the critical skills that every project manager needs to have if we are to deliver or execute programs or projects effectively? Yes. Yeah. Let me. Yes, Reverend. Yes. Reverend, your hand is up.
Yes.
Yes.
Yes. We can talk about technical skills.
Okay.
Technical skills. And then we can also look at interpersonal skills and then the self-management skills or emotional skills. Now, when we talk of the technical skills, we are looking at your professional skills, the type of skills that you have been trained for, to deliver a particular type of work. Now, human beings are social beings. You need people to work with, so that if you are not able to interact with others, you are not able to relate well with others, then you find it difficult to deliver. So you need that in interpersonal skills also to manage the project or the program very well. And then with the self-management skills, you have to be able to deal with your emotions. You have to be able to deal with your own self, managing your time, managing your attitude, managing, everything of yours, so that you fit into whatever projects you are managing. So combining all these skills will give you that holistic approach to work well as a project manager or programs manager.
Thank you so much, Reverend. Yeah. So Reverend talk about technical skills, interpersonal skills, self-management skills, or what we call the emotional intelligence skills, time management skills. These are some of the skill sets that project or program managers must have so that they can be effective in the day-to-day discharge of their activities. Yes. Let me find out from Sandra, what other skill sets do you also think will add up, yes, in developing the skills to manage projects effectively? Yes. Hello, Sandra. We seem not to get Sandra. Okay, let me find out from Kingsley. Yeah, hello, Kingsley. Hello, Kingsley.
Please, can you hear me?
Yes, please. Yes. We're talking about skill sets for project or program managers. Yes.
Well, with project management skills, there are so many of them, but generally it comes down to the basic ones that you need to manage a project very well, which is organization. We talk of teamwork, we talk of prioritizing, and also having the right knowledge base. It could be that you are the leader or you are in charge of a particular project, but you may not have the basic knowledge or the right knowledge about what the project is. So other than that, you are going to have a serious problem with the project. But most importantly, it all boils down to how you manage the time, you manage the people, your negotiation skills, risk management, time management, the planning, communication. So these are some of the key soft skills that any manager will require or will need to manage a project very successfully.
Thank you so much, Kingsley. So Kingsley mentioned about risk management skills, negotiation skills, teamwork. Yes. And then the right, knowledge base. I think the same thing as Reverend mentioned about technical skills or technical skill sets. Okay. So with all these skill sets, what we want to ask is how do we develop them? How do we go about developing these skill sets? What are some of the strategies that we can use to develop some of these skill sets? Yes. All right. Yes. Yes. So let me ask a discussion. Start. Let me try from Kofi. Yes. What are some of this? How do you develop? What are some of the strategies that we can use to develop some of the skill sets? Yes, Kofi. We seem not to get a Kofi on the line. Okay. Yes. Mrs. Simon. Hello, Mr. Simon. Hello, Simon. Okay, we seem not to get Simon. Okay, yeah. Let me find out from Mr. Kudin. Yeah, hello, Mr. Kudin. Hello, Mr. Kudeni. Yes, Sandra, your hand is up. Please go ahead. Yes.
Okay, so thank you. I think one way you can develop some of them, well, two, I want to speak about two. One is to have like this course that we've just been through. It's been a real eye-opener on how to get things done. And then another way is also to have a way to make it easy to manage yourself. So for instance, when it comes to time management, you want to have an organizing system around yourself. There are tools that are quite good in helping you to be able to manage your time. And I think in one of the lectures where they exposed us to some tools to even help you track the progress of your projects, so that you can easily get others to give in their input, or if when someone needs challenges, when to bring them on board. So you can use tools to help you to develop these skill sets and guide you. And you can also either learn from team members or get yourself a mentor to learn from, or take on courses like this to help you to develop these skill sets. Thank you.
Thank you so much, Sandra, for this insight and then contribution. Okay, yeah. Then we'll move to our final slide for today. That's the application. So how do we apply the concepts and then practices in both program and then project management in our setting, both in our country or in our various departments or units? How do we apply these some of these concepts or practices? Yes. Let's find from Mr. Kudini. Yes. If you can, if your line is okay now. Hello. Yes. How are you? So your line has been fluctuating a little bit. Hello, Mr. Kudeni. Okay, we seem to not get him. Okay, all right. Yes, let me find from Reverend. Yes.
Yeah. Practice, they say, makes man perfect. So if you don't put whatever you have learned into practice, nobody knows you have learned something. So applying this to our cultural setting is to put into practice whatever we have learned. And as we do, we get to know it better. And then we are able to use it better too. Thank you.
Yeah. Okay. Thank you so much, Reverend, for this input. Yeah. So we're looking at how we can apply the concept in projects. At least we've learned about the autobots, both how to balance the three constraints. When you look at this whole pandemic, particularly for in our context as in Ghana, how do you think the coronavirus program, how do you think we've been successful in its implementation? Have we, how would you weigh our success, rate as far as this particular program is concerned? Since we started in March, closing borders, activating lockdown, creating motivational packages, doing follow-ups, that's contact tracing, and so on and so forth. How has all these things, how successful have we been in applying these concepts in our national coronavirus program? Yeah, so let me find out from I think today we're having a little network challenges, so most of our people are not able to do. Okay, let me go back to Mr. Kudeni, if we can get him again. Yes. Hello, Mr. Kudeni. Yes. Yes.
Can you hear me?
Yes, please. We can hear you now.
Okay. Today I'm somewhere, so sorry, guys.
Yeah. Okay. We notice your network has not been that stable.
Yeah,
okay.
Yeah. So I just queued in, and I heard you talking about the coronavirus, how we have been able to handle it.
Yeah.
To me personally, I think the government has done wonderfully well. Right from the onset, he put up systems and mechanisms in place so that we can handle the pandemic. And so far, so good from what we have seen and heard. I think we have been able to handle the pandemic as a nation, irrespective of some challenges and problems here and there. But on the whole, I think the government and the Ministry of Health have been able to manage the pandemic very well, comparing to other nations and what is happening in other nations. To me, I think the government has done very well. But the pandemic itself, when you come to our institutions and then our places of work, how we also queued in. For me, as a tutor, I think that the pandemic has hit the education sector strongly. And because we don't have strong internet service in our various schools, I think for that aspect, the pandemic had a greater effect on the various schools. And to me, the schools have not been able to manage that aspect very well. From my point of view and where I am coming from, network challenges, online teaching and learning has been very challenging since the pandemic started. Thank you.
Thank you so much. Yeah. So just a follow up to it. Do you think, looking at the three constraints, budget, scope, timing, do you think we, as a nation, we've had any challenge in any of these areas? That do you think we've had a budget challenge in addressing this pandemic? Yes, Mr. Kudeni. Okay, we seem to have lost him. Okay. Let me find from Festus. Yes. Hello, Festus.
Yeah,
Yes.
Mr. Hussein. Yeah.
Very constraints in you know, as a nation addressing the pandemic. Which area have we had much of our challenge, and which area have we done well in terms of scope, timing, and then budget? Which area have we done well, and then which area do we need to work on? Yes.
Yeah, thank you very much. To me, as a nation dealing with the constraints, definitely no nation has unlimited resources. We have resource constraints. As I said earlier, when it comes even to the debate about frontline issue at the health sector, if government could afford it, everybody would have been a frontliner, and that incentive given to the selected few as frontliners would have been given to all, but that was very difficult. If we look at our fight with this COVID, initially, the various health institutions were having serious challenges when it comes to these PPEs. It was a challenge as a nation we faced, but thank God, I think as we progress through the system, we hardly hear of the PPE issues. In terms of coverage, I think as a nation we've done well because if we look at our response time from the March, I think the first or second week of March when report, we discovered our first cases through the period late May and through June and July, when we got to the highest levels, the scope covered, we've done well because government has extended various supports to go to the educational sector. We've handled that section very well. At least many schools may not be in session now, but at least along the line, measures were put in place, which means that those sectors were also covered. Almost every aspect of our economy has been factored in, has been considered in the fight against this COVID and how we can combat the virus. The closing of our borders are all measures we took, and I think we've done quite well. But as I said, the place we have suffered is budgets. Yes, and I think it's not much the nation could do about it. As a lower middle income country, the government doesn't have unlimited resources. Our resources are limited, and what I think as a government has been pumped into it. We wish maybe we could have done more, but I think with the way we know the three constraints are linked, our budget inform how far we could go, and I think government has done well in that respect. Thank you.
Thank you so much. Yes. Thank you so much, Festus, for that contribution. Yes. So on this note, take care. We'll bring the discussion to a close. We're hitting the 6 o'clock mark. Yes. Let me find out from these ZS. This is we don't seem to know who is attending the meeting with the phone is ZS. If you could kindly unmute and then introduce so that we could be able to get your attendance. Yes. Okay. So, like we said, we closing the discussion for today. The good news is with the project management, one of the course, the university runs a whole course on it. So what we've just tasted in module 8 is just sort of like a teaser, but it's a whole, program or a course on it. And that'll be running somewhere in the middle of this year. So once the program is activated for applications to run, we'll communicate that to you so that we can be able to subscribe to it. And then also coming up, like you saw on the page, we've posted for upcoming program. The programs that will be coming next year will be, the first one will be on the research in global health. Then we're going to have project management, and then there will be other programs that will follow up. The key is just like we've learned from the project management, which has been part of the leadership and management. There are some of the discussion starters in each one of them. So when you look at research, for example, we're going to learn some few things on other upcoming programs. So once you have the foundation, then we can be able to build on them and then move on. Yes, so we'd like to thank everyone, each and everyone, for coming and then participating actively in the discussions. We hope by now we've been able to submit the part 2 of the ILP and then also the assignments for module 8. Yes, so we'd like to encourage everyone in the next few weeks, we should be closing the curtain on this wonderful program and then looking up to other upcoming programs on that the university will be advertising. As soon as they are advertised and then applications open, to communities so that we'll be able to subscribe to it. Yes, Zetes, let me if you could introduce yourself so that we know your name and then identify you. Yes.
Hello, good evening. Please, my name is Dennis Esibe, and
oh, Dennis.
My phone,
okay, yeah, I saw you earlier on. Okay,
yeah,
by change.
I joined with the different
okay.
I had some technical hiccups. Yeah.
All right.
Thank you.
Yes, I know that your line was fluctuating, so you go in and then out. All right. Okay. Yes. So would like to thank everyone for coming. And then Dennis, kindly give us a opening, closing prayer. Then we'll close. Yes.
Okay, thank you. We are praying. Our Lord and Master Jesus, we are much grateful to you for our meeting and such a successful deliberation. It is our prayer that everything we've learned here is able to put into practice for the betterment of our services we deliver to our clients and our families and whoever, and for the betterment of Ghana as a whole. In this Jesus Christ's name we pray. Amen.
Thank you so much, Dennis. And then we wish all of us a very fruitful evening and then day. Bye-bye.
Bye.
Bye.